Hi, everyone. So this is Simba. He is my buddy and my daughter's buddy. And so he's just going to give a little cameo for this part of the video. I know that's super cheesy. It's fine. So for this half of the module, the first part of the module this week, we'll be talking about biopsychology and neuropsychology. So I'll just briefly explain what those subfields are. So biopsychology has to do with the biology of the brain and the nervous system, basically. So how do the different parts of the brain work in concert? How do they connect? How do they control the functions that we do as humans? Things along those lines. Neuropsychology is the applied half of that. So I teach our clinical neuropsychology course. If you take that online, you'll see that I've prepped that as well. And with neuropsychology, we actually start with problems in the brain. So whether it be a stroke, a head injury, something that was innately born, some sort of surgical procedure you had, and then we work backwards. Okay, so if that part of the brain is damaged or missing, which functions are impaired? And then from that, we can kind of piece together what do those parts of the brain do. So clinical neuropsychology in particular is a lot like abnormal psychology, just clinical psychology, but it focuses on the brain-based disorders. Again, biopsychology, you're often going to be doing research. You're going to be doing things like studying the intricacies of the brain, often with animal subjects. So you'll see that part of what you'll look at this week will talk about that in particular. And then neuropsychology, you can do research for sure. And in fact, one of my publications is a neuropsychological research study that I did with one of my professors in grad school, where we actually did a study with older adults, had them come in, got fasting blood work. We gave them some memory scans. They did some physical measurements. He walked laps around a gym. And we were able to find some really cool stuff about amyloid beta in that, which is actually related potentially to the pathology of Alzheimer's. So essentially what that study concludes is staying in healthy shape physically as well as mentally can help you as you age. Neuropsychology can be completely applied though, and in fact, a lot of neuropsychologists, this is what they do. So neuropsychologists do a lot of assessment. So a lot of their time is spent giving lengthy batteries and using their clinical skills to figure out how not to overwhelm their clients with those. They might assess, an athlete after they get a concussion. They might assess a child who comes in and they think that the child might have a learning disorder or ADHD. They might assess someone after they have some sort of brain procedure. I did some neuropsychological assessment while I was in graduate school. And one of my clients actually came in after she had electroconvulsive therapy, ECT, which used to be called shock therapy. And it's a rare symptom, but it can actually happen that you have some memory problems after receiving that. And in fact, she was one of that small percentage. We were able to show that with the neuropsychological tests. In addition, I have a lot of experience giving learning disorder and ADHD assessments. For some strange reason, when I was in grad school, I got all the people who didn't have either of those things. A lot of the people I assessed, in fact, were having severe symptoms of depression or anxiety, and they can manifest exactly like one of those disorders. So doesn't mean we weren't able to get them help. In fact, you can get accommodations for those things, much like you would ADHD or learning disability, in terms of having tests in distraction-free environments, things along those lines. So certainly very interesting. I also had the chance to work in a traumatic brain injury clinic while I was at the VA. So this was kind of difficult. If you're not familiar, traumatic brain injury, or TBI, in particular mild TBI, or the other word is concussion, is the signature injury of Operation OEF, because of all of the roadside bombs, the improvised explosive devices, or IEDs. So we saw a lot of fairly young men who had, tinnitus, migraines, memory problems because of, not only perhaps an injury caused by falling or debris hitting them, but also just the concussive blast essentially moves your brain around in your head like jello. So that's very important. I've also done some of these types of assessments on patients with multiple sclerosis, MS. So I've been able to see them in pretty applied settings. There are a lot of really cool things neuropsychologists can do. So we've had an adjunct in the past who was the team neuropsychologist for the Norfolk Admirals, who are our local hockey team, as well as the William and Mary football team. So certainly you can get jobs along those lines. You can also do neuropsychology in forensic situations. So let's say someone is suing because they got a head injury on the job. Then you might be called in to assess them and determine the extent to the damage to their abilities. So this is very much the biology, psychology intersection. This is, a little bit of neuroscience right here. And this is, if you are interested sort of in that intersection or sort of medical psychology and in applied ways, in particular really fascinated by the brain, these are areas to focus on. The other really nice thing about, if you're really interested in biopsych, is often there aren't as many people interested in those, master's or PhD programs as other ones, so it's not as competitive. For neuropsychology, you would typically go to a clinical master's or PhD program and then specialize in neuropsychological assessment within that in some way. So I did it just as sort of something I was interested in, but I certainly had people I worked with who were much more interested in it and got much more extensive experience. So I hope that gives you a nice little overview of what these fields are like, and enjoy learning about them more throughout the module.